name is Starla Ferguson, and today I'm going to tell you about my career choice in respiratory therapy. According to the textbook Egon's Fundamentals of Respiratory Care, the earliest technicians were known as oxygen therapists in the early 1940s. According to the respiratorytherapistlicense.com, the number of respiratory therapists is expected to increase by 19% in the next 10 years. Today I'd like to tell a short story about why I was motivated to become a respiratory therapist. My son Chris Jr. was born premature, weighing 4 pounds and diagnosed with Charge syndrome. His premature lungs, along with the many complications of Charge syndrome, such as the coarctation of the aorta, resulted in an emergency tracheotomy and an emergency lateral thoracotomy for the coarc repair. Chris Jr. was sedated and placed on a Trilogy 200 ventilator for roughly 3 weeks. During that time, I worked with and seen more respiratory therapists than any other hospital personnel. Unfortunately, Chris Jr. passed away in May of 2018 due to undiagnosed complications that resulted in respiratory failure. Watching him grow over the short years that he was with us, I realized that I wanted to be a respiratory therapist to help other children like Junior breathe. So today we're going to be discussing the educational requirements, the everyday duties and responsibilities, as well as some of the benefits of the profession. As with any medical profession, you must complete a college education, and for respiratory care, you must attend a school that has been accredited by the Accreditation Commission on Respiratory Care. Tyler Junior College has been accredited and is one of the only colleges in the East Texas area to offer a respiratory degree program. This is where I will be completing 60 hours in the program before I apply to get my license from the National Board of Respiratory Care. To maintain certification, you have to perform certain tasks and duties. So let's talk about the duties and the job responsibilities. The number one responsibility is making sure that a patient is breathing properly and comfortably by assessing the patient for any signs of respiratory distress or low saturations. Administering an aerosol-based medication such as albuterol can help open up the lungs and allow for easier airflow. After any medication, a patient should be monitored for any changes in vital signs. A respiratory care is the study of cardiopulmonary therapy. So a respiratory therapist is supposed to be able to tell the respiratory rate, the heart rate, O2 saturations, and blood pressure. Being able to read the monitors properly allows the respiratory therapist to take the right actions. Excuse me. A respiratory therapist can place a patient on a ventilator with O2 support and adjust the settings like CPAP or BiPAP or passive SIMV. If a patient has been sedated and intubated or has an artificial airway like a trach, a ventilator can be used for breath support. Managing a trach is a full-time daily routine, as the respiratory therapist must clean the stoma twice a day and change the ties daily. Suctioning is also very important because you want to make sure the stoma, where the trach sits, is clear of any mucus. So suctioning has to be done routinely as well. A person can greatly benefit from this career, as if suctioning isn't beneficial enough by clearing the mucus plug, an RT is only required to work 3 days a week, allowing for more time with family. The salary is a bonus as well, which according to the respiratorytherapistlicense.com, the estimated median is between $60,000 and $70,000 annually. In many other healthcare professions, the demand for respiratory therapy is on the rise, with salary following suit. So today, we have gone over education, job duties, responsibilities, as well as the benefits of respiratory care. As you know, Chris Jr. was my inspiration, so I hope that you get some inspiration from my presentation today to help you pursue a career in respiratory care to help other children like Chris Jr. breathe, live, love like everyone else.